Hey, I'm Dr. McKay of Core Health in Darien. Today I want to again continue our little mini series on spinal decompression. And today one of the questions I want to go over with you, I get quite often, is how do I avoid surgery? And that's a very good question because my goal is for you to avoid surgery just as much as you. It turns out to be a measure of success. If I can help you avoid surgery, in many cases we can, but there are also cases we can't help you avoid surgery, which is kind of frustrating, but it is the truth. So what happens is when a patient comes here, typically we're going to review your MRIs, CAT scans, X-rays, and treatment notes from other doctors or other physical therapy offices where you may have gone to. And what we do is then we compare it to what we have to offer and how do we fit. Because if you've already done something once that didn't work, it may not make sense to do it again. So we try to avoid that and save you time. So like I said, there are some cases we cannot help, and it's important for us to distinguish that early on so we get you to the right doctor, because if you need surgery, you need surgery. But what we try to do is in the first 4 to 6 weeks, we set a treatment goal that you are a good solid 50% better. By 50% better, I mean you're feeling at minimum 50% better within that 4 to 6 week period. It lets us know you're in the right place. Typically, I would like it to go quicker, and when I can get it to go quicker, I'm just as happy as you are, because getting good results is a lot more fun than not getting good results. It means we have to send you out, which we don't want to do. So when a patient comes in, we do a certain examination, looking for things that I think may have been overlooked most of the time. Because why look for the same things if they've been already examined and treated and evaluated? So what I'm going to look for is very, very unique. I look for different muscle groups that I have found over the course of my career, my 20 years treating low back pains that are involved. And they're not necessarily in the low back areas, muscles that connect to the low back, to the front of your body, down the sides of your legs. And they all play a role in it. And you have to do a solid because your low back pain may be very specific to one area, but I can guarantee it affects other areas, especially if you've had it for a long period of time. So our examination is very, very different. I use a very specialized technique called applied kinesiology to help me identify the real key areas that need to be addressed. And a lot of times we'll start working on that immediately the first day, looking for some significant pain reduction because it gives us credibility with the patient. Nothing better than having a patient see pain reduce that was there for a while. And so I enjoy doing that, but the patient enjoys it as well, because it lets you know there's a better chance statistically that we are going to be able to help. And then once that's done, we start introducing spinal decompression if you are a good candidate for it within about a 7 to 10 day period. I do not like to put people on right away. I have, and I don't like to do that anymore, so I just don't, because the body has to get into a position to maximize the healing process, where we're going to get you the highest level of healing possible. So we have to kind of set the stage for that. And that's why we do some soft tissue work, some massage, some stretching, some exercises, basic, but to set the stage for a better healing process when it comes time for the spinal decompression. Now, what I'd like to do is maybe on this short videos, I want to show you how spinal decompression works as well. And what we do is we decrease the pressure within the disc space. So I'm going to use a little visual tool here. Hopefully you can get this and appreciate it, but I'm going to, if you just take a look at what I have here, it's a gel. And if you could just, for argument's sake, understand that the gel inside here is the disc material. So what I'm going to do now is, in the case of a bulge, herniation, a rupture is not going to be a good thing. But let's just take some of this out here. I'm going to bring this in so you can actually see it. And let's push. Get anything out of there? It comes. Okay, so now this is a bulge. Use this for argument's sake as a bulging disc. What spinal decompression does in a very concise way, it decreases pressure within here. So what we do is this pressures. This could be putting pressure on a nerve or blocking the hole where the nerve comes out. By creating negative pressure in the disc space, sucks back in, and then you get back to normal as quick as possible. I know I may have oversimplified it, but it really is basically what happens. And then the therapy becomes more effective. Then everything else, the chiropractic adjustments and the physical therapy and massage therapy, uh, will become infinitely more effective. One thing I got to tell you is, once you've had a back problem, chances are, I can see people pretty much getting a good 5 year run out of a series of decompressions treatments. But if you're not going to exercise, if you're not going to stretch, you're going to be at it again. But you know what? The same thing would be true with surgery, except surgery is a very final type of thing, which is why I don't recommend it. But then again, I'm not a surgeon. So what I like to point out is spinal decompression can help you. I invite you to find out if it's right for you. But you do have to give it at least a 4 to 6 week trial to see if it's going to be right for you. Now, we do see a lot of success in those 6 weeks, but it's kind of up to you to follow through and make sure you get and listen to us as far as the exercises to do at home. We love helping bad low backs. We don't help everybody, unfortunately. The exam process where we weed people out and see if it's even something we can offer you. Once again, I'm Dr. Brian McKay from Core Health in Darien, and if you'd like to contact us, look at the links below, and we'll get back to you as soon as possible. Thanks a lot. Have a great day.